So you've been diagnosed with diabetes. Type 1 or type 2 diabetes, depending, you can get a lot of help with things like acupressure. Hi, my name is Mark Brinson. I'm a doctor of Oriental medicine and an international speaker. When someone's diagnosed with diabetes, you have to separate between type 1 and type 2. Type 1 diabetes usually happens in youth, and the pancreas completely shuts down insulin production, and it's a little more difficult to deal with. It definitely needs insulin and/or medication. Type 2 diabetes is what most people experience that needs a little bit of self-help. Type 2 is diabetes insipidus. It usually starts sometime around the age of 30, and it has to do with diet, weight, and exercise, and is characterized by weight gain or blood sugar problems. Some of the best things that you can do, in addition to the acupressure that I'm going to give you, is make sure that you're following a good eating schedule about every 3 hours, that you're also getting in adequate proportions of protein, carbohydrates, and simple sugars, fats, but limiting the simple sugars. Now, as far as acupressure goes, a few of the points that are great for that. One is located just 1 thumb width under the umbilicus, or under the belly button. And it's a small point called chi that's good for overall energy in the body, but also can stimulate digestive function as well, help you to process your food a little bit better. So, overall energy and help you process food. Another one is a point that's just below the knee. There's a little prominence there, and just lateral, or to the outside of the leg. In the belly of the muscle, there's a point called stomach 36 that's good for digestive function of all types. And the one last point that you may want to use is on the inside of the leg, about 1 hand width above the prominence at the ankle. This is spleen 6. It's the meeting point of all the yin channels. And you'll find that there's a nice little hollow that your thumb can sink into at that point, and it can stimulate overall digestive function as well. I would use these in combination. They can help to increase your metabolism, make your insulin production go a lot more smoothly. And always remember, this is specifically tied to your diet and your exercise program as well. My name is Dr. Mark Brinson, wishing you health and happiness in your life.